Lindsay Clancy has brought a lot of awareness to postpartum psychosis, and I understand that many people do not understand what postpartum psychosis is. Postpartum psychosis is not postpartum depression, it is not postpartum anxiety, it is not the baby blues. It affects 1 to 2 out of 1,000 women and happens within the first 4 weeks of postpartum. And some of the hallmark features and signs are going to be hallucinations. You could have auditory hallucinations, you could also have audio hallucinations, so you could be seeing things that are not there. Oftentimes people describe them as shadows or scary figures or other things and people that they're not really familiar with. Either way, it's incredibly scary. They might be hearing voices, and these voices are not saying positive things. They're not saying you're a great mom, that you're doing all the right things. It's a very critical, almost demonic voice in the sense where it just tears you down, and it's very scary to go through that. So having hallucinations, whether it's auditory or visual, are some of the hallmark signs of psychosis. Also, it's because there's a dip or a change in hormones. So this could be your progesterone, your estrogen, your cortisol. It could all be fluctuating. So this does require medical attention, oftentimes hospitalization with a psychiatric provider for medication management in addition to counseling. Sometimes that warrants inpatient. Sometimes, people can treat it and get stabilized and move on to a PHP or IOP program. And so outside of the hallucinations, there's delusions. There's a break in reality. You're not knowing what the time is, what the day is. Sometimes you have chaotic, disorganized thoughts. There's delusions of, not feeling well. And it's a scary situation. Other things that could also involve postpartum psychosis is paranoia. Fear of something happening, whether it's your child having a tummy ache and thinking that their internal organs are collapsing. It could be paranoia around something happening to your children or yourself. It also heightens your anxiety, your stress responses. Also, a hallmark feature is mania. That means that you have a lot of energy. You have a lot of energy and you're not sleeping. It could be hours, days. When you don't sleep, you can also have increased symptomology. And so it's important to address all of these things. But these are some of the hallmark features. Let me know what surprises you the most about psychosis. For me, it's going to be that there's a lack of intervention, that you have a baby and 6 weeks later, they're like, here's a depression or anxiety screener. And, this happens within 4 weeks, so you might catch it, but you might not. That's why I'm recording this video. It's not to shame anybody that is going through this. It's to bring awareness, understanding, and stigma. I think that the medical system could do a lot better. I think that providers could do better. And I think also as therapists, we can definitely start screening for it more often than not. My name is Shinazi Kone. I'm a licensed professional therapist, speaker, consultant, here to remind you that you're not alone in your life. If you are having any thoughts of self-harm, suicide, homicide, please call 911. Go to the nearest emergency room. Take care of yourself and take all of the time that you need because listen, postpartum is a lot and you deserve